Hi, I'm Michelle Ginsberg. I'm a thoracic radiologist, and I'm Director of Cardiothoracic Imaging and Vice Chair of Education at Memorial Sloan Kettering Cancer Center in New York City. So what is a ground glass opacity and what does it represent? A ground glass opacity is a nodule that's, well, as the name implies, is ground glass, meaning it's sort of got a hazy appearance and you could see the parenchyma through it, meaning you could see the vessels through it. So it's not dense and you could see right through it. Now, generally, the smaller lesions, which are less than 5 millimeters, are associated with atypical adenomatous hyperplasia. But then there's a spectrum. So as the lesions get bigger in size, they may represent adenocarcinoma in situ, or maybe very rarely they may be invasive, but that's generally rare. Now these ground glass nodules are generally followed up with CT imaging, and while they may represent a malignancy, it's generally an indolent malignancy. So it's important to follow these up to, depending on the size, so if they're greater than 6 millimeters, up until 5 years. Now we know from data from the Asian population that up to 10% of these ground glass nodules may grow, and 1% of these pure ground glass nodules can turn out to be adenocarcinoma. It's important to realize that while some of these lesions are pure ground glass, they may end up developing a solid component within it. And that's the part that becomes the invasive component. And it's important to measure the solid component within the ground glass lesion, not just the overall size. In fact, you could argue you could just measure the solid, and that's how you assess if it's become an invasive component, and continue following the size. And it, obviously, if the solid component grows, intervention may be needed at that point. Now, that's because studies have shown that the solid component in these nodules predicts the overall survival better than the whole lesion, which includes this ground glass component. And generally, the ground glass part is correlated with the lipidic component of pathology. But as I mentioned, very, very rarely, pure ground glass nodules can be invasive. But what we look for in these nodules is the development of a solid component within this ground glass opacity. Define A.A.H, which is the abbreviation for atypical adenomatous hyperplasia. It's generally a benign lesion, and they're usually less than 5 millimeters in size and are incidentally detected at pathology, and also could be detected on imaging. But sometimes on a specimen, they will identify these atypical adenomatous hyperplasia within the lung parenchyma.